Good stuff. All right, looks like we're broadcasting live.
Brilliant.
So super excited to be speaking with the Director of Innovation and Challenges at Mars Discovery District, Shahab Shahnazari. Did I do that right?
You sure did. Thank you, Kal.
Good stuff. How are you doing this afternoon?
I'm pretty good. How are you?
Good. Listen, I really
Excellent.
appreciate you joining us. I know how absolutely busy your schedule can be, so I appreciate you carving out a bit of time to spend with us today. So
My pleasure.
to those of you guys who are joining us, today we're going to be discussing how Mars has partnered with the Canadian government to run 2 data challenges to improve public health. We'll talk about the role innovation played, but more specifically, the role crowdsourcing played. And lastly, I'm going to have Shahab weigh in a little bit on how crowdsourcing can be potentially used across the healthcare industry and not just specifically to data related challenges. But before we get kicked off, just a couple really side notes. First of all, our CEO, Christian Cottacini, who is going to be joining us for our discussion today. He was called away last minute and he won't be joining us, but he sends his apologies. So it's just all me. So secondly, if any questions show up for you guys during the webinar, please feel free to post them in the Q&A chat box on your Zoom window. We'll dedicate a few minutes at the close of our webinar to address any questions. So with that, so let's get started with some introductions so I can get us kicked off. My name is Kal Sahota. My role with the team is the VP of Possibilities, which is just a really fun way of saying I get the absolute pleasure of connecting with organizations literally all over the globe, speaking to them about their innovation strategies, how to implement crowd as a key component of that strategy. Background's kind of boring, 25 years in financial services. I was an executive, I was a financial advisor. Our team is virtual, but I'm located in beautiful Vancouver, British Columbia. So that's a little bit about me. Shahab, tell us about you.
Hi, everybody. Shahab Shahnazari. As Kal mentioned, I'm the Director of Innovation Challenges at Mars. For those of you who don't know what Mars is or what we do, Mars is an innovation hub, and we really are one of the largest in North America. We operate at 3 different layers. Layer 1, and this is about 50% of our activity, is meant to support entrepreneurs and ventures. So by providing them with access to talent, capital, markets, advisory roles, things like that. So it's really about in building up the innovation supply. Level 2 is, or layer 2 is, you can be the best entrepreneur possible, but if there's nobody across the table willing to procure your solution, then why go through that exercise? And so level 2 of what Mars does is increase the receptivity of the ecosystem to absorb and use the innovations that our ventures are providing. At the same time, there's recognition that it's not a binary interaction. I may be willing to sell, you may be willing to buy, but there are systemic barriers in place that inhibit that from happening. And so Mars operates also at that 3rd layer. And that 3rd layer is our systems change side, working with government, working with private sector organizations and citizens to be able to address the systemic barriers that inhibit the procurement and use of innovation. My team specifically works on the innovation challenges, which is why I'm here to speak to you today.
Love it. Awesome. How long have you been there, Shahab?
I've been at Mars for about 5 years now, and I actually built up our innovation challenges stream from scratch.
Awesome. Love it. So now diving into some of the questions. So Mars, you guys have successfully run 2 data challenges in partnership with the Canadian government over the last couple of years. So how did that partnership begin?
So we've had a long-term partnership with multiple departments and agencies at the federal level in Canada. The one that we had specifically with Public Health Agency of Canada was meant to improve the way that they use information to monitor the health and wellness of Canadians. So the reality is in Canada, at least at the public health level at the federal side of things, they use our census agency called Statistics Canada. Data that Statistics Canada typically generates is self-reported surveys, which many of you guys may be familiar with. It has its own inherent weaknesses. In many cases, there are some sampling issues. You don't get the depth of information that you're looking for, the geographic coverage that's required. And most importantly, by the time that data is put together, aggregated, and lands on the Public Health Agency of Canada's doorstep, it may be 2, perhaps even 3 years out of date. So that's difficult to use when it comes to identifying how are Canadians being well, how much sleep are they getting, things like that. So the question came to us is, can you help us identify new ways or new sources of data that can help us better understand the health and wellness of Canadians? We didn't have
Mm.
an answer, but what we did have an answer was this methodology called crowdsourcing. We can put you through that process. We can identify what our objectives are. In this case, it's new data sources or new methodologies that can be applied to existing data sources in order to answer those questions. And so that's really how it started. The first challenge that we ran with the Public Health Agency of Canada was actually in partnership with the Centers for Disease Control down in the States. It was our Healthy Behavior Data Challenge.
Mm-hmm.
How do we identify data sources or methodologies that can help us better understand how physically active Canadians and Americans are, how much sleep they're getting and the quality of that sleep, and how sedentary they are?
Mm.
And what was really interesting, and this, I mean, I'm preaching to the choir right now, but what was really interesting about the outputs of this approach was the ideas that came out that really won the challenge were never ideas that we considered in the first place. And that's really what
Interesting.
speaks to the crowdsourcing, the strength of crowdsourcing, right? And I'll give you an example. One of the winners of our challenge actually participated, or rather collaborated with a smart home thermostat manufacturer. Smart home thermostats, you've got them on your wall. In many cases, they come with multiple sensors. You put those sensors around your house, typically in your room, living room, wherever else it might be, in order for it to determine whether you're present or absent in that room. If you're in there, it
Mm.
works to adjust the temperature based on what your previous settings are. Well, those same sensors can be leveraged to determine how frequently you're walking past that. Let's say you put it in your bedroom and you go in your bedroom and then you lay down. If there's no movement for 8 hours, then you can theoretically think that somebody's sleeping.
Sleeping.
So the data that these sensors were able to gather had these secondary uses that we ourselves never considered, but the strength of the crowdsourcing approach allowed us to access them.
That's awesome. You're reading my mind. I was going to segue into that,
Yeah,
but digging into that a little bit, you ran the Healthy Behavior Challenge, and you also ran the Opioids Data Challenge.
yeah.
In the results of those that participated, did you find that they were, from public health or from data analysis? Tell us a bit about the diversity of the participants.
Yeah, that's a really good question. And the simple answer is it depends on the challenge. So, for
Mm.
example, the Healthy Behavior Data Challenge, there was a wide pool of solutions that potentially could apply. So, if you think about it, the example that I gave with a smart home thermostat has nothing to do with public health, has nothing to do with health, but this researcher was able to leverage that information and apply it to our case. So in the Healthy Behavior Data Challenge example, we actually had quite a number of participants that had nothing to do with health and had nothing to do with wellness. These included private sector organizations. There were researchers that were researching in separate areas that were able to
Mm.
apply to our challenge as well. That was healthy behavior. Now, the opioid data challenge was an entirely different beast. And in this one, we had a little bit more homogeneity in terms of the participants that came in, simply because that it's such a difficult problem and there are very few organizations that are working in that space. One could think that, hey, maybe you could use Twitter or social media in order to determine the number of overdoses that are happening. And yeah, you could potentially use that. How accurate the results are, have a big question mark around it. So for the opioid data challenge, which the focus of which was to be able to quantify in near real time or as close to real time as possible the number of overdoses that are happening in Canada, the vast majority of the participants were either safe consumption sites, frontline organizations that are interacting with people who use drugs, as well as public health agencies as well. And really the focus is those are the organizations that are really active in it right now, and those are the ones that are actually working to address the issue. So we had a little bit less diversity on that one.
Gotcha. So it sounds like the broader the ask is,
Yeah,
oftentimes you have a larger bandwidth of individuals that are coming in with different levels of diversity,
it does. Yeah,
which is what really, to speak a little bit more to that, is just that's the true creativity of what you're tapping into.
that's right.
You literally have no idea where your solutions live, and there's no way that you could have potentially envisioned that somebody already had created or developed a product or a solution that
Yeah,
could be then repurposed for what it is that you're up to. You would have otherwise not been able to tap into that. So there's such a power to that. We get so stuck in today's, well, not so much in today's day and age, because I think crowdsourcing and innovation has really moved the dial for a lot of organizations. But
mhm.
in earlier days, there was this sense of the experts know, go to the experts. And
Yeah,
now, everything's kind of shifting a little bit where, you're an expert, and this is how it shows up for me. You're an
yeah,
expert because you had and I will say the privilege or the luxury of being able to attend a post-secondary school, to
Sure.
have the degree, to get
Yeah.
the job that now makes you the expert.
Yeah.
But what about those of us that, or maybe not us, but maybe those individuals in the world that didn't have that luxury?
Yeah.
So now are we precluding them from offering their level of ideas and expertise because we're shortchanging ourselves? And that's really how it shows up.
Absolutely. Absolutely. And I mean, from our perspective and from the perspective of the partners that we work with, crowdsourcing is such an incredibly powerful tool that not only allows you or exposes you to a diverse range of solutions, but also positions you as an organization that engages non-traditional stakeholders. So if you think about the more traditional funding models that exist, at least in Canada, we have, if you want to procure something in your hospital, you typically have to go to RFP, proposals
Right.
are submitted, you select based on perceived ability to do the work because they haven't done the work yet. You give them their money and then off they go and they do the work. Well, in that case, you're making an assumption that they're actually going to be able to come back with quality, and in a lot of cases, there's cost overruns. From a governmental perspective, they have grants. You apply for a funding program. Again, you're providing a proposal that has a perceived ability to do the work rather than actual ability to do the work. And again, you're funding based on that. And with the crowdsourcing approach, the work is done up front. They're providing you with access to all of the solutions and the details associated with it. You're able to pick the best solution because you've seen all of them and you know that they're able to do the work because they did the work. You give them their prize or their incentive and then hopefully work with them afterwards as well. And so we definitely see this as an incredibly powerful tool, and our partners are realizing that as well.
It's almost like you're getting, I like to say to organizations, you're getting free research and development. You have
You really
all of
are.
these participants, and in the case of the opioids challenge, for example, there were over 600 that
Yeah,
actually participated.
that's
So
right.
you have 600 minds put together that are working to solve your problem, but
Yeah,
you're only awarding the one. So it's
that's
actually
right.
such a risk mitigated approach, which initially I think with organizations, it was showing up for them as risk heavy. But once
Mhm.
they dug into it a little bit and realized how it actually works, it's actually quite, it mitigates risk tremendously
That's right.
because you
Yeah.
don't, I mean, if nobody solved your problem, Shahab, then you wouldn't have awarded because it's a challenge, right?
You got it exactly right. And I mean, so from a risk mitigation standpoint, absolutely. From a cost effectiveness standpoint as well, let's say theoretically or hypothetically speaking, you have a challenge with a $100,000 prize at the end of it. Let's say you have 15 submissions that come in. Each of those 15 submissions are worth at least as much as that. And so the reality is you're getting, 1.5, I can't even do the math off the top of my head, in terms of value back, that you're only spending 100,000 plus the cost of running the challenge on. So absolutely, risk-wise, variety and diversity of solutions as well as cost effectiveness, it's such a powerful approach. And that's why you're
Now,
seeing it implemented more and more globally,
yeah,
right? From
absolutely. It's
challenges.gov, I mean,
on the
back to
rise.
wellness. Exactly, absolutely.
Everything is, all of it is on the rise. So let's talk a little bit about crowd, right?
Okay.
So crowd is a term that, is used to talk about encompassing the over 3 billion people connected to the World Wide Web. So
Hmm.
you have this challenge that we're running. One of the key components of a successful challenge is making sure that it's seen by enough of the crowd
Yeah.
so they're compelled to actually come and compete and join in this challenge. So you had leaned on HeroX for some of our consulting services to actually build that crowd out, which, as I said, it worked beautifully. Tell us a little bit about, did you employ some strategies in-house in
Sure.
addition to what HeroX did? And tell us a little bit about what that looked like.
Absolutely. And so, I mean, even before getting to that, what I would say is that in addition to those services and the supports that HeroX provided, one thing that we found incredibly helpful was helping us identify who the audience is that we're looking to reach as well. So we talk about crowd, and certainly we want to be able to expose the problem to as wide a range of individuals as possible. But I think there's a certain recognition that there's a subset of that crowd that we think are going to have the ideas that we want to be
Mm,
able to pull in. And so by identifying who those segments are in terms of our audience, that's that critical starting point where I found working with you guys to be incredibly helpful. And so
mm,
once you identify who those segments are, whether they're researchers in area X or Y, private sector companies or small to medium enterprises. We were then able to kind of take a dual track approach. Track one is working with you guys to be able to amplify the message through your various social media channels and your email blasts. At the same time, Mars as an organization has a fairly sophisticated comms communications team as well. And so we were able to tap our own marketing channels and our own social media channels. And what we found was that they're very complementary to each other. Right. You as an organization, and perhaps we're going to get to this later, one of the reasons that we wanted to work with HeroX was the community of innovators that you have already built up. We as an organization run multiple challenges, and in some cases, the participants in challenge A can also participate in challenge B, or we want them to participate in challenge B. So that community that you build up, all that effort and all that work that goes into building up this pool of innovators that participate in your first challenge, you don't want that to then fall by the wayside. You want to be able to leverage that. It's the marginal cost of being able to then port those over into a second challenge. And that was, so I'll be honest, one of the primary decisions that we made, or one of the primary factors that led to our decision to work with HeroX, is that community of innovators that you build up, the ability to port them over from challenge to challenge, and then the arms that you have in terms of reaching out via distribution. Now, one thing that was not your fault is our fault, is that in some cases our challenges were very focused geographically. Right. Because of this relationship that we have with our sponsor, we had to go Canadian innovators only. So we weren't able to fully tap into the strength of HeroX's network. What would have been great is if we could run a global challenge at some point, and in that case, really tap into that pool of innovators that you've already built up.
Absolutely, and you say that so eloquently. That is one of the biggest distinctions of HeroX, is that it's the only place that you can actually build, grow, and curate your very own crowd. And in essence, we're actually positioned as a social network for crowdsourcing. And the spirit behind that is, and again, you've already touched on it, is what showed up for us probably about 2.5 years ago, is when you've already got this engaged community working on this challenge for you. And, starting with, the first challenge that you ran was 250 engaged participants. They're already with you. Once that challenge closed, they would have disappeared. You would have had to rebuild your crowd. That's right. That's the place that we stood and realized, why not keep them with you? So, right. For our participant, for anybody that's watching, I mean, if you go onto HeroX and you go onto Mars, and you Google Mars, you will see that they have their home page on HeroX. And that's where all of their crowdsourcing projects live, and that's where their community lives. So it really gives you that opportunity to be able to tap into them again and again. So that's amazing. And and you've touched on it as well, like two big distinctions of running a powerful challenge is designing it well, and then making sure you're compelling the right crowd to actually come and participate. So tell us a little bit about how you designed your challenge. And I know you've touched on it a little bit already, and particularly those of our attendees right now that are from the healthcare space, like share a little bit about how you got to what you got to.
Well, let's use the opioid data challenge as an example. And so again, not unique to Canada, this is certainly North American in scope, perhaps other jurisdictions as well. One, you have to understand the problem. And in many cases, Mars, we act as an intermediary supporting other organizations that are looking to run their challenges. And so in the case of the opioid data challenge, there were 3 kinds of overdoses that happen. There are the fatal overdoses, which are relatively easy to quantify through coroner or medical examiner data sources. There are non-fatal overdoses that end up in the emergency department or a first responder activation. Those are also quantified through existing data sources. The big black box that exists out there right now are non-fatal overdoses that are resolved at the community level. So what I mean to say is that you don't go to the ER, you don't call the cops, you don't call an ambulance. It's somehow resolved either through naloxone or other kind of administration. This is a huge black box at the federal and provincial and municipal level, where we simply don't know the total number of overdoses that are happening in our country. So if you don't even know the total number of overdoses, you can't effectively design programs, interventions, either upstream or further downstream, to be able to address that. And so for us, coming in, working with our partner, in this case, it was the Public Health Agency of Canada as well, was to really understand, well, what's happening right now in the ecosystem? What are the types of data sources that could potentially be applied? Are there any? What are the pitfalls associated with that? who, in our opinion, are the ultimate end users or receptors of that information. The work that we did with the Public Health Agency of Canada was by definition meant to have an ecosystem impact. The Public Health Agency itself was going to be one potential beneficiary of the work that we did, but it wasn't meant to be the sole one. So we had municipal, we had provincial level public health organizations, we had frontline communities. These are the different people that would adopt the solutions that came out of our challenge. And so in order for us to be able to, one, design a challenge that would result in outputs that would be of use to them, we had to engage with them up front. So one big approach, and something that I would share with the others on the line here as well, is as you run a challenge or as you start thinking about designing a challenge, think about the post-challenge side of things. So you identify this amazing idea through this incredibly powerful process. What the heck are you going to do once you've identified it? And you have to start thinking about that as early as possible, especially in cases where it's no longer a single receptor, but it's an ecosystem of receptors who perhaps have different sensitivities, different focus areas, different priorities associated with that, which you want to bring up front into the design process, as well as the judging criteria in order for you to be able to select a solution that will meet the needs of multiple beneficiaries at the end of it. And so again, it requires a lot of primary, a lot of secondary research, a lot of validation, a lot of workshops to be able to sit down and say, okay, in this, best case scenario, if we come up with these kinds of ideas, how would you use that in order to then come back and inform the nature of the solution? So what I would say to those that are considering that we're running their own challenges, the design of the challenge is more work than all the rest of it. Designing an effective challenge will take as long, if not longer, than the actual challenge itself, excluding the post-challenge side of things where it comes to adoption and implementation.
Absolutely. Very well said. And, your team did an amazing job. So Shahab's team actually designed their challenge. They ran with it on their own because they had that level of expertise and subject matter expertise in-house. They were able to do that. There are some of our clients, particularly those that are running really large technical challenges, that we then lean in and support. So, so we can design your challenge for you. And it's because we do design challenges. Do I 100% agree with your comment on, the amount of work and effort it's involved and actually getting that challenge designed well? Because ultimately, if your ask isn't clear and it doesn't tie in and there's not a through line to what you're looking for, then the results aren't going to be what you're looking for. But it won't be because the crowd didn't respond accurately. It's because your ask wasn't clear. And that's right. Super, super critical. And you've spoken to that really well. So I appreciate that comment.
And Kal, one other thing that I would add there is that there's a delicate balance between being too open-ended in terms of what you're looking to get versus being too prescriptive. Yeah. If you're too prescriptive, you're going to get very focused solutions. And the reality is you should just go through a traditional procurement process because you know exactly what you want. You don't want to get that diversity. But if you're also too open-ended, you will be inundated with solutions that perhaps don't really apply and perhaps don't really add any value back. Yeah, so there's that delicate balance.
Yeah, there's different levers that you can pull, absolutely, when you're designing the challenge to see, how broad you want it, how succinct you want it. Yeah. Now, tell us a little bit, and you've touched on this already a little bit already, but so you've run 2 successful challenges, and they're both hugely successful. Great community, great results, great participants. Tell us a little bit about where you're at now. So let's talk about, you can talk about both or one or the other.
Sure.
Now that you have your solution, where is that at? How did you take that and then bring that in-house and get it moved forward?
Absolutely. And really that's where your work begins. Once you've done your challenge, once you've figured out what that idea is, what that winning solution, whether it's technical, whatever it might be, that's when you actually start doing the work. And so right now, I'll give you an example with the opioid data challenge. I think the team closed that out a couple of months ago. And so right now we're currently in the process of really supporting the 2 winners. One was Guelph and the other one was Brave Button from out in BC, actually. In terms of one, identifying receptors for them to be able to scale their technology. So the focus of our challenge was identify an approach that has worked in a specific jurisdictional area, but then scale that up in order to be able to cover the country. And so right now, a lot of our activities are one, identifying receptors, whether they are safe consumption sites, whether they are supportive housing, whether it's municipal public health organizations, it doesn't really matter. We're having conversations with them in order to increase their receptivity. Remember, I talked about level 2, increase their receptivity to absorb the solutions that came out of our challenge. In many cases, it's not straightforward. In some cases, they think they've got a better idea. It's about validating and making sure that the solutions that we've identified make sense. In some cases, it's easy because if you recall, we included their perspective up front in the design phase. So that continuity is there. That's one. Two, in many cases, the potential receptors are cash strapped. I mean, if you're a safe consumption site, your focus really is on supporting those individuals that are using your services. So what we're doing as part of our post-challenge activities as well is identifying funding programs that exist that Mars can support both the innovators, so the winners of our challenge, and the potential receptors to co-apply in order to be able to fund the scaling activities that are required for the two solutions to be able to have that global perspective. Now, that's step one of our post-challenge activities. And step one really is just scaling the solution, getting them into the right hands. The next step is really the more critical one, is once you have that critical mass of solutions that are active out there, is what do you then do with the data that they're generating? Remember, the whole objective of the Opioid Data Challenge was to be able to source solutions and data sources that can then support intervention and program design. Well, we have to collect that information in order to then be able to do the analysis required to then design the policy or the interventions. And so it is, to put it lightly, a long-term engagement for us. So now the real work begins. So if you think about the Opioid Data Challenge, I think it was maybe 9 to 10 months from beginning to end, excluding the design side of things. We will be spending at least a year, if not 2 years right now, making sure that those solutions get into the right hands and the data that they generate result in the answers that we're looking for.
And that really just depends on also, are you looking for a tactical solution? Are you looking for a strategic solution?
That's right.
When you have something that you're looking for, you can crowdsource something as simple as, I'm launching a new product and I need product packaging.
Sure.
That's going to be much simpler, much easier to do. Or, something even simpler. I actually ran one, name my next webinar, which is super small, but you can literally, crowdsource for anything. But when you have the larger strategic things that you're crowdsourcing for, these are strategic initiatives that your organization's identified that you want to move things forward. And what you're speaking to is now, once you have your solution, you're almost bringing it back to traditional business, taking what you have, implementing it back into, how it's now going to get moved forward into the processes that you've already got built out within these organizations, right? So, the innovative part of it is you've got that solution. Now you're going to take it and you're going to immerse it back into traditional business. So that bridge between the two can oftentimes show up as maybe cumbersome or confusing. But when you think about it that way, it's actually super simple. You have your little package with your solution. Now you're going to bring it back to your team and you're going to get going with it.
Absolutely. Yeah. And I mean, so in examples where, for example, let's say Mars is running their own challenge and we are the primary beneficiary, yes, it makes sense because those relevant stakeholders have been engaged up front and their receptivity to using the outputs of the challenge are there. In cases where an organization has no sense of the challenge, has not been involved in it at all, and we view them as a potential receptor, there's a lot of work that needs to be done to increase that receptivity, the change management that goes with it, a lot of that stuff. And especially if there's a network of organizations that are like that, the amount of work that has to go into it is quite high. And so again, for those organizations, as you mentioned, those strategic challenges where there are multiple beneficiaries, engage with them as early as possible, but bear in mind that once your challenge is done, the real work now begins.
Gotcha. So now tell us, I'm going to remind our audience, if you guys have any questions that are showing up, please make sure you drop them into the chat. We're going to finish up in a couple of quick questions. So one is, so what else are you up to? So you worked on these two. So what do you have in development that's coming down the pipe? Tell us a little bit about that.
So we've got a bunch of challenges coming down. I'll give you two examples of things that are somewhat getting to a point where we can kick them off. They're both in the design phases right now. The first is for a spinal cord injury association out in BC called Rick Hanson Institute. So the Rick Hanson Institute right now has a focus on activity-based therapies. And so if you are an individual with SCI or spinal cord injury, there are two types of exercises or therapies that can be typically taken. There are compensatory exercises, which are meant to, for example, build up arm strength in order to be able to push your wheelchair. But then there are ABT or activity-based therapies, which are more meant to regenerate. So for example, there is a mental component to a physical activity in order to then be able to strengthen the connection to neurons in order for you to be able to regain a function that perhaps you have lost. So one question that's come up around this relatively newer area of therapies is, one, how do we quantify it? So if you think about batch to batch variation in terms of how a physiotherapist or an occupational therapist implements these ABT-based therapies, there's no continuity between them. There's no best practices that have been defined yet. So the challenge right now that we're starting to design is, what are some sensors, what are some solutions that can enable quantification not only of the intervention, so the ABT therapy, the specific one, and the measurement of the metrics associated with that, but also the health outcomes that result. So from an individual or a patient with SCI perspective, they have really three priorities. First is sexual function, bladder function, and bowel function. These are the types of outcomes that they're looking to achieve, in addition to an array of others. So what we'd like to do is quantify the intervention, quantify the outcome, and then try to link these two together. So for example, what type of ABT has resulted in improved bladder function on the part of an SCI patient? So in that case, really, it's a technology play. We're looking out there. What are sensors that exist right now? And again, the reality is that, at least in the health space, there are a number of silos, but at the same time, recognition that technology can transfer. So if you look at geriatric care, heart and stroke type research, a lot of the solutions that exist there, especially around recovery and rehab, can apply into the SCI space as well. So we're still trying to figure out who the appropriate solutions or the appropriate types of organizations are that we'd like to participate, but that at a high level is that first challenge. Second challenge, and this is again a technology and data challenge, is we're working with a global vehicle interior manufacturer right now that envisions a future for the car as a health and wellness type of clinic. So in this scenario, if you think about the amount of time that you spend in the car, perhaps in the example of a commuter driving to and from work, if we can build a network of sensors within the vehicle that can either monitor your stress levels, your heart rate, whatever else it might be, in order to have, one, immediate feedback. So for example, let's say somebody cuts you off, your heart rate shoots up or your stress levels go up, maybe classical music comes out, maybe blue lighting is generated. It's just this understand and then react to a situation like that. That's one. Another that we're exploring right now here as well is longitudinal collection of information for use in your own health. So for example, you will go to your family doctor maybe once a year, maybe twice a year, maybe, I don't know, every 5 years or so. When you go in, perhaps you go in for your physical, that snapshot that exists that's taken for you is literally one snapshot, 1% of your life, if not even less of that. If we can increase the longitudinal nature of the information that's collected in there, your healthcare provider and you as an individual will have a more fulsome perspective into your health and wellness. So for example, heart rate or blood pressure rather. There are studies that show that when you go into your doctor's office, whether you have white coat syndrome or not, the results of that reading are not actually reflective of the reality of you as an individual. Right. So can we look to the vehicle interior to augment or enhance that entire experience? And so what will happen as a result of this is, one, what are the data sensors that will enable quantification of whatever vital sign or metric we're looking to measure? Two, what do you do with that information? What are the algorithms required in order to be able to determine whether there's a delta over month 1 versus month 2 in your average resting heart rate? Things like this. So the challenge there, at least as it is right now, we're looking to two types of challenges. Challenge one is technology. What are the sensors that enable quantification? Challenge number two is a more data or an analytical mechanism of what are the, or provided with this data source, what are the use cases or outputs that you could generate, and what are the algorithms that will allow that to happen?
So interesting. Like both of those are just so powerfully interesting. And And I am very familiar with the Rick Hansen Foundation,
Great.
actually. So it is local to BC. And unfortunately, so I'm going to do a shout out to my nephew, Arsh. So he actually had a spinal cord injury. So for me, when I hear about, everything that we're up to in the healthcare space, and this is going to be true to anybody that's listening and anybody in the healthcare space in general, health is something that's critical to all of us.
Absolutely.
So, that now takes me to my final question. So how do you, from your perspective, you're obviously 100% bought in to the whole idea of innovation and how it's driven by crowd. Tell us how you see it actually impacting the public health and the healthcare industry as a whole.
Mm-hmm.
How do you see this, crowdsourcing and innovation impacting that?
It's not unique to Canada. I mean, globally, you can see crowdsourcing is growing. There's no question about that. I mean, I can't remember what the name of the organization is, but I subscribe to emails from Crowdsourcing Weekly. Like, there's literally an organization called Crowdsourcing Weekly. There are conferences that happen around this. You think about Obama and the challenge.gov. You think about organizations like Nesta, HeroX, XPRIZE. This is not something that is going to go away. When you think about things like Wikipedia, or what's that, GoFundMe, we are applying this crowd approach to a bunch of different areas, whether it's knowledge and information, whether it's financial or monetary, or whether it's innovation and solution oriented. So my anticipation is that we're going to see increasing application of this methodology across multiple sectors. Now, specifically in the public health and health space, they're going to lag. So if you think about how forward-thinking sectors are, health and public health are a little bit more traditional, a little bit more conservative, a little bit more hesitant to get involved in that sort of thing. Now, that's from the institutional perspective. From the private sector side, where those that are developing technologies, devices, whatever else it might be, I see that as accelerating. But if you want to focus more on the formal medical system or the more formal public health system, the amount of validation that needs to go into a lot of the solutions or the applications that they're working on are long. Now, that's not to say that you cannot upstream that and say, okay, well, we're going to run this challenge for you to identify a series of solutions, then go off and do that validation that you have to do regardless. Go ahead and do that. And I think what we're seeing is a realization or kind of a greater inclination to use these kinds of things. But what we have to start doing more of is pointing to these good examples. So pointing to the examples that, the Privy Council Office and the Impact and Innovation Unit of Canada does. Point to the work that HeroX does with some of their other partners and show the value and the power of this kind of approach. Because the reality is, unlike a lot of the examples that I provided you today, which were fairly data oriented, crowdsourcing doesn't apply to just data. Crowdsourcing doesn't just apply to digital solutions or applications. You can quite literally apply to any kind of issue that you have, right? Just like you mentioned, I want to name my webinar versus I'd like to identify a technology that will take me to the moon and back multiple times over the course of a week, right? So at the end of the day, it's the power of that diverse range of individuals that you pull together. And in order to, in my mind, what we're seeing more of is multidisciplinary teams collaborating on a single solution. And that's where I think the future is going to be is, and if you think about the feature that HeroX actually has, that partner matching feature that you guys have, that's really powerful. I may come in and I may have a small part of the solution.
Right.
There may be somebody else who perhaps brings the citizen or the patient perspective. There may be yet another one who brings in kind of a more focused area from a geriatric or stroke research perspective. Combined, we can then come up with a solution that meets the needs of SCI and perhaps is even more powerful than the starting point because we've incorporated all these multiple perspectives. So yes, crowdsourcing is going to accelerate. Health and public health may be a little bit delayed in terms of the adoption of that as a methodology, but we're also seeing a greater push towards multidisciplinary teams collaborating on the solutions.
Wonderful. Awesome. Thanks so much for that. And you know what, I think we're running pretty close to time here, but I want to leave some time for some questions. So should we dive into some questions? We just have a couple of them, I think, that have shown up so far. Yeah. How do you evaluate the cost effectiveness of each challenge you conduct in order to demonstrate that the ROI was greater than the cost to design and implement it?
That's a really good question, and there's no one answer to that. So you can actually look at it from a purely time and materials perspective in terms of how much effort went into designing that challenge itself. It also depends, Taylor, on what you do with those solutions that you didn't select as a winner. So for example, if you look at it fairly focused, you ran a challenge, it cost you, let's say, $100,000 to run the challenge. You gave a $50K incentive at the end, that's $150,000. If you were to compare that to a more traditional procurement process, there's a discussion around, one, could you have even done a more traditional procurement process in order to address or find the solution that you're looking for? In some cases, that's a conversation that needs to be had with the procurement team. Maybe they don't want to go down this longer term pathway, and perhaps in some cases they do. So it really does ultimately depend on the problem that you're looking to address and then the potential receptors on the tail end of it. So if you're looking to run a challenge similar to the one that we've run for the Public Health Agency of Canada, where it's not just a single beneficiary, but it's a multitude of potential receptors, then you have to include that into your calculation as well. What were you able to add to them that perhaps they wouldn't have been able to do in and of themselves, but also what is the impact of the adoption, the implementation of that solution. And in a lot of cases, that delta cannot be measured in a 6-month time frame, a year. In a lot of cases, especially with our opioid data challenge, from a scaling perspective, but also from a what do you do with that data perspective, we will not be able to have a measurable delta until perhaps a year, if not even longer down the line. So it really does depend on what that time horizon is.
Sure.
Who the potential receptors are, and what your objective is around running this challenge.
And the complexity.
I'm sorry, I don't have a direct answer for you, Taylor.
No, it's good, right? It's like, ROI for any business situation is going to really depend on the actual strategy you're applying. Doesn't necessarily mean it's a one size fits all. So I think your answer occurred pretty clear for me. So thank you so much for that.
Sure.
We have one, actually, that's to me. You talk about the HeroX platform. Where can I go to learn a bit more, and how much does it actually cost to use it? So the cost is, everything's right on the website itself. So there's nothing here that we have behind hidden. So if you go to our website, you look at pricing, you'll see it there. It's a percentage of the prize value. So if you run and host a challenge for $10,000, it's going to be 18% of that. So it's pretty simple and straightforward. If you want to augment your experience on the platform, and we talked a little bit about some of the services Shahab and his team leaned into, we can certainly support you with some consulting services, but the self-serve approach is very simple and straightforward. As to how it works, we have a really great screencast actually that Liz has put together that you can take a look right on our knowledge base. You can look there and it'll walk you through all the features and functionality. Shahab has talked a lot about, the teaming function and how it shows up and how you can keep your crowd. It's such an amazing tool. And that's really what it is, guys, at the end of the day. It's a business tool that you're utilizing. And there's a lot of simple, easy ways that you can apply it. But our website is really robust. But then you can always just email us directly and we can walk you through it as well. We have time for one more quick one. So I'm going to pick one that seems a bit fun here. Shahab, how did you get involved in innovation challenges? What steps in your career led you to the current role at Mars?
Something about Mars as an organization is that there is no one career path to come here. What I will say is that I did my graduate studies just up the street here at the Hospital for Sick Children. When I was doing that, I actually came to Mars to participate in their Entrepreneurship 101 courses. And really what that was meant to do is increase the level of entrepreneurship in graduate students, but also more, the wide public. Walking into the building, it just had this certain cachet, it had this certain feel. And I think it was from that moment on that I was like, I'd kind of want to work at Mars. It's got something there that I want to do. And when you come to Mars, one thing that's, again, unique to Mars is that you can create your own path within the organization as well. And so how I got involved in innovation challenges was a little bit fortuitous, working with a client that was receptive to experimentation. So if you recall, earlier on, I talked about the Public Health Agency of Canada came to us with data gap questions. If they had said no to our proposal around applying a crowdsourcing approach, then Mars wouldn't have an innovation challenges practice here. And so the fact that they were receptive towards experimenting, the fact that they were so forward thinking in terms of going after this approach was the reason why we have innovation challenges at Mars.
Gotcha.
Yeah.
So it sounds like you walked into the building and you felt inspired and you
I
just
did.
ran with it, right? That's the heart of what you have, isn't it? Is You know, it's how do you inspire and how do you hang on to that inspiration and turn it into passion. And you
That's right.
sound incredibly passionate about what you do. You know, you still sound probably just as inspired today as you did 5 years earlier. So
I hope so. Yeah.
I absolutely wholeheartedly really appreciate your time. I know we had to reschedule one time because you are so busy in what you do, but your insights, your experience, you know, extremely valuable feedback. I absolutely loved it. Um, you know, I have to say it's so amazing how government is leaning into innovation,
Hmm.
and it's powerful. You think government organizations, and you've spoken to it a little bit, are can be a little bit old school and you know hard to move forward, but the fact that even government is doing this, you know,
Yeah.
for those of you that are listening and you're part of just any organization, may it be a large brand or a small medium sized business, government's there, people. I mean, if they're doing it, you got to get on this. So you know, if
Absolutely.
you so just, you know, for those of you who are attending that want to learn a little bit more, some of the questions already led to that a little bit, but you know, reach out to us. We're going to send a follow-up email, which is going to include, you know, some interesting information plus a recording to what we chat about here today. But listen, on behalf of myself and Liz, Shahab, thank you so very much for taking the time to connect. It was a pleasure working with you on both those challenges, and we're looking forward to working with you on a number going forward. So,
As am I.
have,
The pleasure was all mine. Thank you very much, guys.
oh, you're most welcome. And thanks, everybody. We're going to sign off now. Have a wonderful rest of your day.
Take care, everybody. Bye-bye.